right, Don. What brings you in today? You are here for an acute appointment.
Well, sir,
What can I do for you?
my ear is all plugged up, and it's not normal. I thought it was late Saturday night. It was because I may have laid on my face, or the CPAP from the pressure going back into the nostrils was plugging it. But Sunday and Monday it just keeps being plugged up. And I tried to use the vibrator on the sinus, as I know it, through here to unplug the sinus, but that does not work.
Vibrator?
A vibrator, yes, so it would shake whatever may be in there loose. That may be funny, but I thought it might work.
Okay, so you are not, your right ear is, does it have pain or does it have fullness?
It has fullness. It's got a little ache in the jaw here, but nothing that I would call really drastic ache.
Okay, so you have fullness, and are you able to hear from your right ear?
I can hear barely, but I wear hearing aids normally, but when I put it's an in the ear hearing aid, it just makes this feel worse in here, so
Okay.
I don't wear them today.
Okay, so have you been having some cold or have you been having some sinus infection or any cold lately?
Nothing more than just getting up in the morning and clearing out with.
All right, so this has been going on for last 5 days now, this fullness in your ear.
Saturday, Sunday, Monday, this is Wednesday.
This is Wednesday,
Yeah.
okay. And you use CPAP at night,
Yes,
and you've been using it for a long time?
well over 2 years, I think.
Okay. Have you had this kind of a problem before?
No,
This is the first time?
yes.
Okay, all right. Let me see what is going on in your ear. Do you have any other issue, any other problem?
Not with the hearing, other than having lost hearing during the years.
Yeah. Okay. Let's see what's going on with your ear. Let's see your normal ear first. There is no wax, normal tympanic membrane, normal night light reflex. Looks good. Same here, no wax, nothing. Normal eardrum. The exam looks fine. You do not have any tenderness in your neck, right?
No,
There is no lymph node. You open your mouth. Just relax. Say ah. Say ah. Any pain in your throat? Any
No.
other problem?
no,
Do you have any tenderness in your sinuses?
no,
Any pressure?
no pressure there might be some right.
So you feel a little bit of pressure here.
Yes,
Okay. All right. And this is going on over the last 5 days, right?
right.
Okay. And you didn't have any common cold or anything out of the ordinary. Do you have any neck pain or headache?
No headache,
Mhm.
and I have not had any neck pain. The last thing I was here for was bronchitis, and hopefully that all wore out.
Okay. All right. Show me your neck movement. I just want to see. Turn your neck all the way there and then turn it on this side. Do you notice any difference?
It's a little stiffer right there when I turn to the right.
Oh, it is stiffer.
A little bit stiff there.
For how long it has been stiff? Were you aware of it?
Pardon?
Were you aware of it, that this right side is stiff?
Not really. It does not hurt. It's just a little
It
bit
is-
restricted to turn that way.
But it is not restricted on that side.
No,
Okay. Can you do this side bending? Two side bending? Any difference between the left and the right side?
a little bit of pull here.
Okay. Can you go up? What happens when you go up?
Nothing, really.
Okay. When you were turning your neck, did anything change in your ear?
Not that I noticed.
Not yet noticed. Okay. Well, Let me try and see if this fullness is coming from your neck. Because if I can impact it right now, then I think that may be the answer. Otherwise, the ear exam looks normal. There is no infection. So then it is, we are dealing with something known as Eustachian tube dysfunction. You know, the tube which connects your oral cavity, pharyngeal cavity with the ear. And I think that might be plugged, and that's why it is causing this fullness feeling which you have in your ear.
Okay.
So we'll see. Let's sort it out one thing at a time, and we'll go from there.
All right.
So what I want to do is, I want you to sit upright and do this neck movement for me. So you're sitting upright like this, and you retract your neck. Yeah. Just try to focus on your neck. Don't move the whole body. Just go back. Okay, keep your eyes horizontal. Just turn your neck like this. Yeah.
Like that?
No, you're moving your whole body. Just try to move your neck as if somebody comes in front of your mouth with a bad breath. You do like this.
Yeah, I can do that.
Yeah, good. Go back. Do it around 10 times. Okay, again, try to focus more on your neck.
Like that?
Yeah. Go back, your chin will automatically come down. So the idea is not to put your chin down, idea is to go backwards. Yes, you got this movement good. Yes, good job. Good job. Try to do 10 more. Try not to move the upper part of, just try to work on your neck. Yeah, good job. You're doing that. And with every movement, try to push as much as you can. Good job. All right, have you noticed any change in the fullness in your ear?
Maybe minor, but
We don't know. Okay.
No.
All right. Let me help you guide a little bit more. Okay?
All right.
So let's go back. Do the retraction. Yeah. And I'm just going to apply a little bit of pressure. Okay? Go back. Doing okay?
Yep.
Go back. Go back. Go back. And I'm going to do a sustained retraction. I'll keep you here for 30 seconds or so. Doing okay?
Yep.
All right. Have you noticed any change in your ear?
I had a little pop.
You had a little pop?
A little pop about midway through.
Okay. So how's the ear fullness now?
About the same, but I don't know, it may be a little better audio. I don't know.
Can you hear a little bit better or no?
Perhaps.
We don't know. Okay.
No.
We will see. All right. Let's move your neck and see if the stiffness is still there.
Some of it's gone.
Some of it is gone.
Yes.
Okay. Now tell me that fullness which you came in and with this stuffiness in your sinuses, is there any difference on the right side?
I don't think so.
So the fullness and the stuffiness is still the same.
Oh, basically just like it was,
Okay. All
except
right.
that little one pop.
One pop. So we will try working on it one more time.
Okay.
How is that?
We'll try anything.
Yeah. All right. So Don, let's try one more time. Sit upright and try to move back. I'm going to do a sustained retraction and just relax. Yeah. Go back. Good job. You are able to go more. Just relax. Go back. Just relax. Go back. Relax. Okay, go back. And I'm just going to keep you here for a minute this time, okay?
Mhm.
How's it going?
Okay.
Any change in your ear?
I really don't think so.
It is still full?
Yes,
It is still plugged up?
yes.
Okay, move your neck. Any difference?
There is some lesser tension there,
How's the fullness on the right side of your sinuses?
right?
Yeah.
This right here,
Yeah.
it feels okay. It's about from right in here, just,
It is still there.
yeah.
Okay. What we are going to do is we are going to try the same thing in a different direction and see if we can gain
Okay.
something.
All right.
So I'll show you. You can get up from there. All right. So you are in this position. Keep your elbows more towards your chest. And I will make you retract as much as I can, and then with your hands lock your head in that position. Okay? Okay, go up, retract. I'm just going to apply. Now lock your hand. Yeah. Keep your head in this position. You feel tension here?
Mm-hmm.
Yeah, keep your head in this position. And we'll leave you, you feel there is stress in your neck?
Yes.
Okay, good. We'll keep you in this position for 3 minutes this time.
Okay.
Okay? Doing okay, Don?
I'm alive.
Let's assess it then. Why don't you sit up and then we'll see how you are doing. We may do it again. All right. How is the fullness now in your right ear?
I think it's lesser,
How much lesser?
maybe a third.
So a third improved or a third is left? Two-thirds is
Third
improved.
less.
A third less.
Yes.
All right. Okay. And how's the fullness on the right side of your sinuses? Right side of your face?
I think it's a little better,
Okay.
truthfully. It doesn't feel quite so full right here.
All right. Okay. We will try one more time then, Don.
Okay.
We are gaining, we are moving in the right direction. It seems like, you know, you are showing some improvement. Are you able to hear better?
Did you say feel better?
No, hear from your right ear better.
I think so, a little better, yes.
All right. So I will work on it a little bit more and then let's see
Okay.
how we go. Okay, move your neck. Do you see any difference in the stiffness?
There's some release here.
All right.
As you turn it this way, it's not.
And you also had this fullness on the right side of your sinuses.
Right.
Is it still the same feeling?
Well, I think this really is not as great as it was the first time you pressed it.
So it feels better?
I think it feels better.
All right. So we are going to try that same position again, but I'll try to push you more. And this time, in addition to retraction, I'll move your neck up,
Okay.
if that is okay. Can you do it? Show me how you will do on sitting. So first you retract, and while it is retracted, go up. That's what we will do in that position, and we'll lock your head in that position.
Okay.
Is that fair?
Yeah, if you get a rope.
Yeah. So we will move your neck in parallel to what your position is. Now retract. Yeah, very good. And now extend all the way up. Move up, all the way up. Good job. And now here with your hands you will lock your position. You feel the pressure here?
Yep.
Okay. So now you will stay in this position again for 2 or 3 minutes. And then we'll see what happens to your right ear. Okay? All right. So Dawn, it has been, I think, 2 minutes, 2.5 minutes, roughly. How are you feeling?
Okay. I can feel a tension, but I have to get out of position and tell you.
Okay, let's get up. Let's see how you are.
I'm alive.
Yeah.
I think it's less, I don't know whether you call it sore, but I think it's more relaxed than it was.
Okay, how's the fullness?
It's a little less.
So then the second time.
Yes, it's,
So since you walked in and now, how much difference is there?
well, the difference is not a half yet, but it's probably, I don't know, between, difference between half and a third, but it's better than it was.
Okay.
So what you recommend, exercising it?
Let's continue working on the retraction. Okay. Do 10-15 repetitions every 1 or 2 hours.
Okay,
And then do that position where you retract and then go up and lock your head in that position. Okay.
okay,
And we will visit again in 2 days.
okay.
And we'll see where you are.
We'll try.
Okay.
Take care.
We'll see you in a couple of days.
Alrighty.
So you are here 2 days later. Tell me, were you able to do the exercises?
I've probably done 40 more times with the extension of the neck than you asked me to do because it felt good.
Okay.
Okay. The fullness in this area is not as great as when I left here.
Okay.
This soreness and hair was really not sore, but it was uncomfortable.
Uh-huh.
Is better.
Okay.
So I didn't do any extensions this morning because I'm lazy getting up, I guess. But
Yeah.
anyway, but I have done some of the neck exercises.
All right.
That seems to help. And I can hear you a little bit better than when I left here.
Okay.
Uh,
So do you still have fullness in your ear?
I have in this portion right here, it was all around here when I left. But it seems to be, I can hear you a little better and it's more right in here.
So do you still have fullness on your facial area?
This area doesn't feel bad. It doesn't feel as bad as it did. I'd say it's probably 45, close to 50% better than it was.
Okay. The face or the ear or both?
Both.
Okay.
Both of them.
All right. Cool.
So,
So all around 45 to 50% better. So you
Yes.
still have the fullness.
I have some, yes.
All right. Show me your movements again, and let's see if you're doing it right or not. So how are you doing your exercises?
Stick my head out and I don't try to move shoulders. You said keep your body stiff, correct?
Not stiff, upright and straight.
Right, and then go up there
So you are just looking up like this?
and pulling all this I can.
That is what you've been doing?
Yes.
That's how you were doing over the last 2 days? The
Okay.
exercise?
Repetitions, yes.
Okay. So.
Is that
but
not
the-
right?
Well, I showed you to do this. Were you not doing that?
Well, I did some, but not as many as the upright. So I did it in reverse what you said probably.
Okay, how were you doing this? Were you doing that? Were you going back?
In bed, or when I sit on the bed, before I go to bed, I do that,
How many times did you do that?
probably 30. Just sit there and do it for half hour.
What, this?
This, but not constantly, but sit there for 5 minutes and do that.
So you were doing this or were you doing this?
Both. I did more of this than pulling it back this way.
All right. Okay, so I don't want you doing this. Let's just go in one direction, go back.
Okay.
How were you doing it at home? Can you show us? Okay, so you are going first into extension rather than retraction.
Pardon?
Yeah, you're missing one component of the exercise I told you. First we have to retract. We have to tuck our chin in before you go into extension.
I thought I did, but maybe not.
Okay. You were doing some. Okay, let me show you how I want you to do it. So keep your head in this position. That's how the neutral position of your spine is. And now retract all the way. Good. Retract all the way up. And now extend all the way up. And now lock your position. And don't let the head come off this position. What I would like to do is, I would like to do this movement at home. I think you were going straight into extension, and that is not what I would like you to do. I would like you to do retraction first.
Retraction, okay,
Forget about extension, just do retraction for now.
okay.
That way we'll keep things simple. Can you show me how you are going to do it? Yeah, good job. Do it again. Yeah, you will go as much back as possible. And then you will lay on your tummy and just do the retraction and lock your,
I think
Face.
I'll get a rope.
no, you don't, yeah, go all the way up. You did that fine. Just lay on your elbows, go all the way up, and then lock your head in that position. So do that for 5 minutes, 3 or 4 times a day.
Okay. But today,
Right.
I can tell you that this fullness is practically all gone. Once in a while it'll be there, but
Uh-huh.
intermittently.
Uh-huh.
And this pressure in this area is mostly all gone.
Uh-huh.
And I can turn this way, and I can turn that way.
Oh,
and
wow.
I'll go up
You've
like
got
that.
full, you've got quite a
We're
bit.
doing 90 degrees or whatever.
How's the hearing now as compared to before all this started?
Oh, I didn't hardly have any at all when I came in the first time.
Right. So do you still have problem with hearing, or is it back to normal, or there's
It's-
still an issue?
It's still a small issue,
Okay.
not like it was.
Okay. So in percentage wise, how much better you will say regarding your right ear?
I would say I have it about 75% all the time, once in a while, almost full. But
Okay.
it's not a positive full yet.
Okay. So you didn't take any medicine or any nasal spray for all this issue, right?
No, I do not like taking pills or
Okay, good.
medication.
Good.
If I
Fine.
can wear it off, I'll do it. If I
Right.
can't, I'll be here.
Yeah. All right, Don. Thank you.